Navy Team New London. Today is Friday, March 19th. Tomorrow is the first day of spring, and here's a quick update to keep you informed and aware of Navy and SUBASE New London efforts against COVID-19. Connecticut is welcoming spring with a relaxation of some virus mitigation measures. From stores and restaurants to gyms and places of worship, capacity limits at many community businesses and venues have been lifted. Community gathering sizes have also been expanded, such that social and recreational gatherings at private residents have been lifted to 25 indoors and 100 outdoors. Social and recreational gatherings at commercial venues have been lifted to 100 indoors and 200 people outdoors. Additionally, Connecticut's travel advisory is now recommended guidance, vice a requirement. The state will still require face coverings, physical distancing, and an 11 p.m. closing time for events at venues, restaurants, and entertainment. But all in all, Connecticut will have the appearance of being greatly reopened. Members of Navy Team New London, I urge you to exercise caution. Remember that we must continue to abide by the Navy and SUBASE Force Health Protection guidance, restrictions, and measures in place, both on and off the installation, even when they are more stringent than those placed upon the general public. Safety and security must continue to be our watchwords, not convenience or custom or relaxation or socialization. Many of you may face a challenging question when a friend suggests going out to eat or inviting you to a party. In some cases, the answer may be easy. Those at high risk for complications due to COVID-19 can confidently decline such invitations. Some sailors whose commands place more restrictions on them can also decline easily. For many of us, though, such invitations force us into a moral dilemma, especially for those who may be vaccinated. There's no one single answer to the question, should I go? But I encourage you to remember, we are still in Force Health Protection Condition Charlie. Consult your command leadership, take into account the number of people present, the riskiness of the activity, and the mitigations that we'll put in place. Ensuring we do not increase any undue risk to our sailors, our families, and our mission is critical, especially as new variants of the coronavirus swirl around and may bring new waves of infection. But speaking of vaccinations, Governor Lamont has ordered Connecticut to accelerate the state's age-based rollout of the COVID-19 vaccine. By early April, plans may be in place for the state to start vaccinating all adults over the age of 16. Of course, SUBASE and Navy Team New London continue to conduct our COVID-19 vaccinations in accordance with the DoD and Navy schema and as efficiently and effectively as we can. Each week, the Navy's Fleet Vaccination Tasking Team issues orders to our clinic that dictate how many doses it will get and who in each priority group within each command will receive them. We are currently vaccinating remaining stragglers from our medical workers and first responders and are firmly in the midst of vaccinating our submarine crews, frontline essential workers, and individuals over the age of 75. At the current rate of doses received, it may be weeks before we begin expanding our group of eligible recipients. So you may be asking yourself, should I look into vaccination through state and community healthcare providers? My answer is that getting your shot in the community is absolutely allowed by the Navy healthcare system, and there are easy ways to inform your command and update your medical record. I urge you to get the vaccination as soon as possible. Getting the vaccine protects you, those concerned about you, and the nation as a whole. No matter where it may be offered to you first, on base or in the community, please get vaccinated. Reduce the size of the pool within which the virus mutates and speed us all towards the goal of community immunity. Part of the reason the governor has eased restrictions on businesses is that the state leads the country in vaccination rates. Why not be part of that, part of what gets us to the finish line? Even if you don't feel at risk of COVID-19, your immunization supports broader virus suppression efforts and can signal leaders in our community that this community is ready to get back to business. SUBASE continues to closely monitor local community infection, hospitalizations, and vaccination rates. We take all those numbers into account as we look to reopen services, activities, and opportunities. We will take steps in a careful and deliberate manner, keeping the safety of our personnel in mind throughout, and we will keep you informed. In the meantime, welcome spring, stay the course, and stay healthy out there.